Practices at the University of Miami. And he is a chronic disease and occupational epidemiologist with research interests in public health applications of mind-body practices for the prevention and management of stress and living with chronic disease, and enhancing the health of the U.S. workforce, as well as cancer surveillance and prevention and sensory impairment surveillance. Dr. Lee has developed coursework for students on the benefits of mind-body practices in public health and medicine. He has published nearly 300 collaborative publications in peer-reviewed literature, and he has been continuously funded by the National Institutes of Health and the Centers for Disease Control and Prevention since 1993. He also serves as a principal investigator for the Florida Cancer Data System, the second largest state cancer registry in the United States. And so without further ado, I'd like to introduce you to Dr. David Lee. You may take it away.
Great, thank you so much, Laura, and thank you all for joining today. I could also have an alternate title for this presentation of East meets West, and the encounter of drawing from hundreds and thousands of years of contemplative traditions into our Western lifestyles, and how those practices can really benefit us from a physical, mental, and even spiritual perspective. So I'm going to give you a little bit of history of how these practices sort of found their way into our United States here. And I've been a faculty member here at the medical school for 33 plus years, and I've had the privilege of seeing over time how some of these practices that we'll be talking about today are being applied in patient settings, for physicians and other healthcare providers, and others, and talk a little bit about how the science of studying these practices actually has driven acceptance, greater acceptance of these practices over time. And I'm witness to that even here at the Miller School. So I want to start with talking about Dr. Benson, who is a physician at Harvard, who coined the phrase the relaxation response. And he and his team was studying this for a number of years, and would look at the effects of having folks repeat a word or a sound or a prayer, a mantra, or do like progressive muscle relaxation, where you would tense and relax different muscle groups, and study the immediate and longer term impacts of those practices. And they found that if you could train people to do this, and they would practice this 15 to 20 minutes a day, that there would be they could document benefits of this practice. It became very popular in the public domain. As you can see, Dr. Benson had a #1 New York Times bestseller that was published in the 70s that popularized this concept. But over time, it turned out that there were a relatively limited number of high-quality studies that were published in the literature to show the benefits of these practices. And so while this was kind of an early adaptation of some of these contemplative practices that we could draw from the East, it didn't really expand in any sort of exponential way, unlike what we're going to be talking about momentarily here. So around the same time, we had John Kabat-Zinn, who went on to create the mindfulness-based stress reduction program, was studying for his PhD in molecular biology at MIT. And while he was there, he was first exposed to, I believe it was Zen meditation, and he became a Zen meditation practitioner. And after graduation, he landed at the University of Massachusetts Medical School and started working with patients at the center there who had a variety of conditions: chronic pain issues, fibromyalgia, other conditions that were poorly diagnosed, but more importantly, poorly treated. And so they started referring some of these patients to Dr. Zin's clinic that was created in 1979. And over time, Dr. Kabat-Zinn developed what became known as the MBSR, or mindfulness-based stress reduction program. And importantly, what he another one of the innovations here was that he manualized this intervention. So he built it out so that there was a curriculum that could be followed and replicated. And he also was very cognizant of making sure that instructors were highly trained, not only in the delivery of the intervention, but that they themselves had a very kind of fulsome mindfulness meditation practice themselves. So as part of this 8-week, they would meet, participants would meet once a week for 2.5 hours. There would also be a half-day mindfulness retreat that would be part of the program. But they would, as part of this, they would be introduced to a variety of meditative practices, which we'll talk a little bit about momentarily. But these were things like mindfulness meditation, mindful eating, mindful movement, which incorporated some basic yogic poses as part of the intervention. And then participants would have to practice these things at home, and the homework was pretty demanding. It was often like 30 to 40 minutes of practice, and that became the standard. And the fact that this became highly manualized provided the opportunity for other investigators to utilize this and apply it to a variety of different patient populations and the like. And as you'll see in a moment, there was really an explosion of interest and work in this area. But I would point to the fact that Dr. Kabat-Zinn had developed this and developed it in a way that was repeatable and replicable, was really foundational for the further study of MBSR and other mindfulness-based interventions, as we'll see in a moment. So mindfulness is kind of a popular term now, but definition of it is kind of elusive. And John Kabat-Zinn defines mindfulness as awareness that arises through paying attention on purpose in the present moment, non-judgmentally. And then sometimes he'll add, in the service of self-understanding and wisdom. So that's a lot to sort of chew on, but that is his conceptualization of mindfulness. And these practices that were introduced through MBSR have their clear origins in Buddhist traditions. And again, he was a practitioner himself as he was developing the MBSR program. So John has said that the intention and approach behind MBSR was never meant to exploit, fragment, or decontextualize the Dharma, but rather recontextualize it within the frameworks of science, medicine, and healthcare so that it would be maximally useful to people who could not hear it or enter into it through more traditional Dharma gates, whether they were doctors or medical patients, hospital administrators, or insurance companies. So here we have the clear foundations of these practices acknowledged by the creator of MBSR. So again, in part as a result of MBSR being manualized and could be studied by other research teams, there was an exponential rise in research in this area that really took off in the early 2000s. And what we're seeing here in this graph are the number of randomized controlled trials that were published that were focused on either MBSR or other mindfulness-based interventions. And I want to pause here and just talk for a minute about the importance of the randomized controlled trial. And that is because it is considered to be the gold standard for understanding whether a particular treatment is beneficial. And a randomized controlled trial will take a group of defined population of individuals. It could be patients, let's say 100 patients that are living, living with irritable bowel syndrome, and that 100 patients would be randomized into typically just two groups. One group would receive the mindfulness-based intervention. The other group would receive either no treatment or an alternate form of treatment that could be compared then to the mindfulness-based intervention. And then these patients are followed over a period of time, and then you look at the outcomes of interest. And there's also some subtleties in the control groups that are identified. And in earlier studies, when you're first looking at whether or not any particular intervention works at all, you might randomize the group into, you get the intervention, and then the other half gets put on a wait list, and then the two groups are followed and to see if there are changes in the outcome of interest. Could be depression, could be anxiety, as an example. And then after you make that comparison, then the waitlist control would get the intervention as well. That's a good design, but not as good as randomizing them into two groups. One would get the mindfulness-based intervention, the other would get another intervention that may have particular efficacy in the outcome of interest, but is different, and you are exposing both groups to the same amount of intensity of the interventions, and that helps to control for some other factors as well. So over time, when you look at the kind of the trajectory of randomized controlled trials, you'll see some of the less robust designs are done first, and if things are looking good, then you go to the trouble and expense of doing the harder to do randomized controlled trials. But everything that we're seeing here on this slide are the number of randomized controlled trials that have been published. And you can see that, by by 2013 to 2015, we had more than 200 of these publications in the literature. And again, this is the randomized controlled trials are the gold standard. So in terms of getting acceptance of a particular treatment modality, you really want to see the results coming out of randomized controlled trials. And then the next step is to actually do what we refer to as systematic reviews and meta-analyses. And that's where you take a group of randomized controlled studies and you statistically combine them together. And that gives you a more ability to detect whether or not there's a treatment benefit associated with that particular mindfulness-based intervention. So what I'm showing you here is a bubble plot for mindfulness interventions. And this is a little complicated, so I'm going to pause and walk you through what we're seeing on the screen here. And on the vertical axis are the number of published randomized controlled trials that were assessed as part of a systematic review or meta-analysis. And the size of the bubble reflects the number of meta-analyses that were performed on the available randomized controlled trials. And so a larger bubble means there was more than one meta-analysis that had been conducted. And then on the horizontal axis, we've got the results of these various meta-analyses stratified by whether or not they showed an effect, a positive effect for the mindfulness intervention. So if you direct your attention to the far right-hand side of this graph, this is showing you the summary evidence for the treatment of various conditions that showed evidence of benefit for those who participated in that. And I don't know if you can see my cursor or not, but here at the top on the right here, these are the 32 studies of MBSR that focused on various health outcomes and was showing a positive benefit of MBSR for the treatment of different health conditions. Looking at other things like the psychological, typically this is improvements in depression and anxiety symptoms, also showed early signs of benefit. And by the way, this evidence map is more than 10 years old, so it's I've not seen an updated one. So it's not it does not incorporate some of the more current results. But studies of patient populations with chronic disease, chronic illness, also showing benefits as well. And the green represents other types of mindfulness-based interventions, not MBSR interventions, but you can see that there's some evidence there as well for treatment of depression, treatment of pain, even the treatment of psychosis and schizophrenia. So another kind of lane of research that I believe has really accelerated the acceptance of these practices for the benefit of a variety of different populations, medical populations, people working in high stress occupations, is the neuroscience studies. And I should pause for a moment and just say that, a few decades ago, it was believed that, we were born with all the neurons we were ever going to have. And, there's developmentally, there's a period of intense growth of connections between neurons that sort of started to peak in young adulthood. And then from that point on, it was just nothing but a slow and steady decline in the number of these connections and brain volume and everything, and that that it was just one slow decline as we aged. We know now from the MRI studies that that is just not true at all, that the brain is has incredible plasticity and will respond to stimulus, to respond to inputs, to actually increase connections between neurons within the brain. And what we have seen from studies of MBSR and other mindfulness-based interventions is that you see increases in these connections. You actually see increases in volume in different regions of the brain that are sort of mapped to the practices themselves as a potential benefit of engaging in these practices. And so I want to dwell a few minutes here just talking about what I think is just an absolutely brilliant study that was done by the Max Planck Institute. I believe they're in Germany. And they did this comparative study of mindfulness-based interventions. And what they did was they took a group of individuals that were naive to any of these practices, and they were randomized into 4 groups. There was a control group that received nothing, but there was 3 other groups that received different types of mindfulness training, and those different types are here on the graph. And so the 3 groups that would receive these specific interventions, the first one was the attention and interoceptive awareness group. And that was that group received training in breathing meditation, focusing on your breath, and doing the body scan, where you basically focus your attention on a particular body part for a period of time. Then you let go of that and you go to the next body part, going from the big toe to the heel, to the ankle, to the knee, and so forth. The next group was the metacognition group. And the core exercises there were observing thoughts and meditation. And then they also had this perspective dyad, where individuals would be exchanging different perspectives to one another. And then the third area was the compassion and gratitude intervention. And the core exercises there included another affect dyad, but also loving kindness meditation, where you might have a mantra, may I be well, may I be safe, may I be happy, may I be healthy. You extend that to others in your realm, and then eventually even extend that to all sentient beings. Interestingly, MBSR has, you get trained in both. You get trained at the top in breathing meditation, you get trained in body scan, you get trained in observing your thoughts, and you also get trained in loving kindness meditation. So this experiment was really a nice way of sort of teasing apart those different elements that comprise MBSR and other mindfulness-based interventions, to see if there are differential effects by training in these specific domains. And so what did they find? Well, first of all, for the control group, you got the message that if you do nothing, you might actually experience a cortical thinning in one specific region of the brain, just a aging phenomenon. Going back to that initial concept that there is nothing but a decline in our futures as we age. But here are the changes in this density, cortical thickness, in specific regions that map to the 3 areas of intervention that they had: the presence, the affect, and the perspective taking. And you can see that there really is no overlap that these specific types of practices have very, very focused effects on improving kind of cortical thickening, and if you can call that an improvement in brain health, I do. I would consider that an improvement in brain health. It's fascinating to see that there is this level of specificity in terms of targeting different regions of the brain with these various practices. The other thing I could say that really has come out from just this body of work is that this does not take a long time, and they can really start to see, they can pick up a signal of changes in the brain with relatively short term exposure and number of hours of practice. So we don't really know what the minimally effective dose where you start to see these changes are just yet, but it occurs really in a matter of weeks and months of sustained practice. So this team extensively studied these participants and assessed a variety of things, psychological changes that occurred, physiological changes. And because of the way that they designed their study, they could look to see which type of training would impact these specific domains. So, for example, one of the experiments that they did was studying cortisol stress reactivity in these participants. And having this high level of reactivity is thought to be an indicator of stress's adverse impact on the body just in general. And they found that that the perspective module and the affect module would drive down that reactivity, but they didn't find a signal in that case for the presence module. So there are some differential impacts outside of the brain as well as people are trained in these different modalities. So we're going to now shift and really talk about some other mind-body practices that have found their way here to the United States. And I would want to start by saying that our level of understanding of these different types of contemplative practices, the benefits, the potential risks of these, are just not well studied at all. And even as we move into the literature on the health effects of yoga, that literature base is still accumulating, and it's not quite as mature as the evidence base that I just shared with you in terms of the effectiveness of mindfulness-based interventions. But what we have here is a concept of a tree that brings the branches of the tree are related to different types of contemplative practices. So you notice here on the movement branch, we have a different number of traditions. We have a walking meditation, walking a labyrinth. We have yoga, we have dance, we have aikido, we have Tai Chi, we have Qigong, are all examples of these sort of movement contemplative practices. Over on this branch, which they label as generative, that's where we see loving kindness meditation, but also something called beholding and visualization, even lectio divina, which kind of comes out of a Christian contemplative tradition. All of these things are kind of considered to be contemplative practices, but are really far less studied than the kind of the recent emergence of the mindfulness-based literature that I was just sharing with you. one of the things that's happened here in the United States is that we've had an explosion of interest and practice of yoga, and it's really tripled in the past 20 years. And this, of course, again, comes from the East, and the yoga as practiced in the United States is very different than yoga that is practiced in Eastern societies. It's much more of a way to organize your entire life around, and it has more than just the poses in yoga, which you'll see in a traditional yoga class here in the United States. You'll get maybe a little bit of focus on breath work, but most of it's just the physical poses that you go through. So it's another example of a very secularized version of something that came from the East. But breath practices themselves were really foundational for these ancient contemplative traditions, and the Tao and Hindu religions viewed breath as a manifestation of our principle, vital principle or energy, represented as Shi or prana. And there has been some work done just looking at breath practices, like what are the short-term effects of these practices. But this table just shows you just the variety of breathwork practices that come from the East. Alternate nostril breathing. Down at the bottom, we've got the honeybee humming breath, where you make a soft humming sound as you exhale. And this is actually a practice that is employed in some school-based interventions, because this is something that you can do in a classroom, and students just love to do this particular kind of practice. But there's a vast literature showing that slowing down our breathing can have favorable health effects, and it's across a number of our body systems, respiratory, cardiovascular, effects on our autonomic nervous system. And one example of this is looking at something called heart rate variability. And this is really a measure of kind of our ability to balance our sympathetic and parasympathetic systems, which is kind of core to our sort of stress response that we're all born with. And scientists have figured out that breathing around 6 breaths per minute can kind of maximize that heart rate variability. And also, work has been done showing that it improves our alveolar ventilation, reducing dead space in those sacs in our lungs, and can be helpful in patients who have asthma or chronic obstructive pulmonary disease, as an example. And of course, our physiology, is intimately tied to our emotional responsiveness as well. So emotions and respirations are sort of linked through these feedback loops in the body. So slow breathing can help there with this synchronization, and there's some evidence that this can be beneficial for folks that are living with anxiety conditions. So when we think about yoga, and we'll just kind of focus on how it's practiced in the West here. First there's the physical aspects of yoga, the physical health benefits of yoga, but also the impact that this can have on regulating the stress response system, and also improving overall immune function as well. But because it's also a physical practice, you have all the potential benefits of being physically engaged, physically fit as a modality. And not surprisingly, when you look at taking sedentary people and randomizing them to to exercise intervention, in this case yoga, you get improvements in their exercise capacity. So that makes, I think, intuitive sense for just about everyone. And yoga and Tai Chi and other practices have been looked at in their role to enhance resiliency in seniors as we get older. And this is a meta-analysis, a specific type of meta-analysis that allows you to make comparisons in different treatment modalities. And so when you're looking, again, the outcome here is resiliency. The target population are older individuals. And intuitively, it makes sense that if you take sedentary people and you put them through programmatic exercise, you're going to see some improvements in resiliency as well as fitness, and that's exactly what they see. But you can also see that there are benefits here for both yoga here and some evidence for Tai Chi as well. Now, these gray boxes here are the kind of the estimates of the effect, the degree of the effect. In this case, these are all beneficial effects. But the lines here are represented our degree of confidence that we've accurately estimated that degree of benefit. And when the lines cross here, this vertical line here, then we say, well, we're not really sure that this particular estimate is accurate. And so the Tai Chi is not what we call statistically significant, but you can see that there is a favorable effect there. Sometimes this is just merely a function of the number of studies that you have to include in the meta-analysis. So I think one of the takeaways here is that you can improve resiliency in seniors by practicing both yoga and Tai Chi. Now, this is a report that just came out a few months ago, and it's really the largest study ever done to answer the question on which types of exercise would be beneficial for depression. We've known for a long time that encouraging people with depression to exercise is beneficial for them, and it can result in a reduction of symptoms. But we've not had good data on what type of exercise is most beneficial, and that's what this study has done. So they pooled data from 218 studies with over 14,000 participants, and they statistically combine these in a way that allows us to make this comparison of the relative benefits of these different practices. So what comes out at the top here, and these are roughly ordered by the degree of benefit. What comes out at the top is walking or jogging. And so that's completely in line with the recommendations that we've had for many years on getting people to exercise who have depression as a treatment for depression. And it kind of comes out on top, but closely following that is something called cognitive behavioral therapy, and then yoga is listed here. And all three of these, because these lines here do not cross this threshold right here, these are all thought to significantly improve their depression symptomatology. And Tai Chi is on the list as well. It's a little further down, but you can see that the confidence interval there just kind of barely crosses that line. So we have less degree of confidence. But again, you can see that that's based on a much smaller number of individuals that were systematically studied. That's yoga had 2.5 times more participants. So these error bars tend to get smaller as the number of participants are included in the analysis. So we do see pretty solid evidence that yoga is one exercise modality that can be prescribed for individuals who have major depression. I find it also interesting here that there are a number of studies that combine both exercise and the use of antidepressant medication, a specific class of antidepressant medication. And the effects there were, kind of pooled effects were essentially equivalent to yoga. So, I'd much rather avoid taking any medications if it's at all possible. And so that's again, kind of a prescription of for patients who are suffering, making sure that they're out and engaged in regular exercise, and you also might want to prescribe something like yoga as well as an adjunct to that. So again, because we have less focus until recently on formal studies of yoga, when we look at the impact of yoga on other outcomes, we've got much less data to work on. I mean, this is an example of that. These are patients who have a defined anxiety disorder. And the question is whether or not yoga would help them with their symptoms. They only had 2 studies to combine, and the individual studies themselves did not show a significant improvement. But when you combine them together, you did get a statistically significant improvement in reducing anxiety symptoms. And a particular type of yoga called yoga nidra has been studied in a handful of different studies, and the focus here is on blood pressure. And they do see evidence of reductions in both systolic and diastolic blood pressure for those that were trained in yoga nidra. And then just one last slide here. There is work now being done in applying yoga in different patient populations, different high-risk populations. The meta-analyses are just now starting to be published because, again, we just have a smaller base of research, individual research studies to draw upon. But this is an example of a recent publication, a meta-analysis looking at the effect of yoga on addressing cancer-related fatigue as they're undergoing treatment. And that what they found in this meta-analysis was that yoga, in fact, reduces fatigue, reduces depression and anxiety, and improves sleep quality and quality of life in general in breast cancer patients. And so we can expect to see with time more of these meta-analyses being published across a range of conditions. It's just that evidence base is not as mature as it is for the mindfulness-based interventions that I talked about before. So to wrap up some takeaways here, I would say that the scientific study of the health benefits of ancient contemplative practices is really still in its infancy. We have really so much to learn. The results to date suggest that a broad range of mental and physical health benefits are associated with these practices. But there is so much to learn still regarding the dose and the duration of these practices to achieve benefits. And then I haven't talked about this at all, but actually need to do more work in the field to understand and identify any potential risks associated with these practices. So I'm going to stop there, and I think we should have some time for questions, if I'm not mistaken, Laura.
I want to thank you, David, very much for your presentation. As a clinician, I recommend meditation and mind-body work to my patients. Of course, we live in a very stressful environment, and many patients come in with insomnia and stress-related issues and family dynamic issues. And those patients that actually can start a meditative practice and include exercise actually do very well. So this is for the Osher Center and for what I'd like to see most primary care doctors really get involved in helping their patients move in this direction. It's harder than prescribing a pill for somebody to take for sleep or for anti-anxiety or depression. And so it requires work on the part of patients. And I think we need the opportunity to find a way to set up low-cost classes on these issues for our patients in a larger group modality. But thank you very much for your presentation today.
Yeah, they're driven in part because of the pandemic. There's been a real shift in trying to bring these modalities in online settings, which would theoretically vastly increase the reach of these interventions. So that work is really underway. Can we do we lose treatment efficacy in remote environments? That's kind of an open question. But I think the research to date suggests that these can be translated into a more accessible modality for individuals.
Well, thank you so much for this very enlightening talk. If anybody has any questions, please type it into the chat box or raise your hand. I'm sure it was a very clearly presented lecture, so not sure if anybody has any questions. So I have a question.
Okay.
So it looked like some of the brain research that's been done in meditation, that they might be specific to the types of meditation. Has there been anything that's similar with the yoga type studies?
Not that I'm aware of, but I haven't looked recently into the literature. Almost like take the Max Planck example of that, and just kind of like let's just do the breath work of yoga, and have that arm, and it would be wonderful if someone does that kind of a study. So I mean that. I don't know how much that study costs, but any MRI study is going to be very, very expensive to conduct. So
It's true, and it's really hard to get NIH funding, I think,
yeah.
to do the at least these days, some of this MRI work. I just wonder whether which kind of meditation it might fall into, the presence or the attention. Probably like the breath work. Is that what you were?
Well, I mean, that could be one
to?
element that you could readily isolate, but part of practicing yoga, even in the kind of the secularized West here, is that if you have a good instructor, you're gonna get reminders to be present in your body as you're doing these poses. So that's really a mindfulness component, isn't it? So it's very hard to disentangle that. I guess what you could do is you could just have people instruct people who are naive to yoga to come in, and you could train them on the poses without bringing in any of the mindfulness stuff, and compare that to kind of the traditional approach to training these things, and see if you can detect some differences.
That would be really interesting. So I do have a question. We do have questions about classes here at the Osher Center. We are working on developing classes at the Osher Center. So we'll keep that. So check back. We'll send out announcements.
You might remind everybody that we started a Tuesday afternoon mindful meditation course. So
yes,
I would suggest that if people are interested, they should email you or myself, and we can then send that out to them and give them the times. And it's a virtual meditation class, so we'd be happy to increase the number of people that participate. I think Susan D'Agostino has her hand up.
Still on mute, Susan.
Okay. Hi. Thank you. Thank you for this great presentation. Actually, I'm driving and listening at the same time, so I've really enjoyed it. I'm a retired nurse, but I've also been a meditation instructor for about 10 years. And it's really interesting what you say about yoga and how we have secularized it, obviously, in Western, yoga that doesn't, a lot of yoga teachers don't teach that component of, breathing, relaxation, mindfulness. And that's something that's, we've gotten away from here in the United States, which there are some teachers now who are incorporating it. And I think that's very important because the whole practice of yoga is really based on, if you go to India or any other, where yoga really originated, it's really about pranayama, breath, and then, some exercises. So that was a great point that you brought up. And yeah, I would love to see I did an MBSR course at University of Miami probably 10 years ago, and it was great. That actually was the course that started me wanting to be so interested in mindfulness. And so I think it would be great to offer more of that. I mean, here in Miami, there's just so much stress, just driving alone. So
Sure.
it would be great, at the university campus or downtown or whatever. But yeah, this was a great presentation. Thank you very much. I really enjoyed it.
Thank you. And we got a shout out for the mindfulness offerings through the medical library here for those of you who are on the medical campus. So there's a variety of offerings, and even our own HR department has periodically will offer mindfulness classes, just kind of a one-off, not a series or anything like that, but.
I mean, I think it's just so important for people that are in healthcare, working in healthcare, physicians, nurses, respiratory therapists, or whatever. It's such a high stress environment, and we're dealing with patients who are sick and family members.
Yes.
And if we're not taking care of our healthcare workers, how are they acting or reacting to the patients? And we kind of see how they are. So I think that's a great thing that University of Miami is doing, that trying to at least engage the medical school. And, I know Dr. Mishijad does a lot of that. And so it's wonderful. It's so innovative. And I think it's a great thing that you guys are doing. So thank you. Thank you again.
Thanks for the comments.
One of the major benefits, though, in learning how to do meditation is people who are skilled at it themselves, when they're involved in stress situations and they've had a good background in meditation, they can reduce their stress almost instantly. And I think it's a good point about our own healthcare profession, that we're often involved in stress situations. I know in primary care, when there's 3 or 4 patients waiting, the nurse is on top of you, people are calling you and texting you. It's very easy to become stressed. And if you've learned how to meditate and to give yourself suggestions, bring yourself back to a calm point during those stressful times, these are really health promoting activity. So I'm a big proponent of it. And I appreciate the comments that our entire campus should be learning how to meditate.
So I apologize for not seeing the hand raised earlier. I need to learn to scroll more. There any other questions? Oh, there's another question.
I think Susan, I don't know if Susan had her hand up again or not.
No, I was trying to lower it, but just going along with both what you both said, and with healthcare workers, man, just learning the practice of the pause. And that's like such a simple practice, take deep breaths when you're in a stressful situation. I know I worked ICU for years, and just that practice alone, which is so simple, it just helps so much. It's wonderful. Yeah.
Well, someone needs to do a study, but I think that moment when you're between patients because you're hand washing is an excellent opportunity to do, a 20-second drop in. And it would be great. It would be great to train providers to try to, pair that time with kind of clearing the mind of all of those things that Dr. Schwartz had mentioned, that are present as you're going from patient to patient.
Absolutely.
Well, I think we're kind of at the end of our time. And again, David, I want to thank you for your presentation and the work that you're doing. And I guess I would invite you to sit down with us at the Osher Center, and perhaps we can come up with some projects that we can do together.
Absolutely, yeah. Well, I think we're overdue for an advisory committee meeting, right?
You're absolutely right.
So
that is true.
yeah. Okay, very good.
Thank you again.
All right,
Very
thanks
great.
everyone.
Thank you so much for
Bye.
your presentation.
My pleasure.